Hello and welcome. This is Dr. Gerard Cuomo. I'm here with my case. This is a case that we've been filming along the way. It's a lower left molar, very large root canal post and core buildup that was removed. And now we're going to, we finally made it through endodontics. He's had a root canal on this tooth. Let me just get this in focus. Here's his crown. This is a lava crown. It's a zirconia core with porcelain baked to it, and so this is the crown itself, all ready to go in now. I fit checked this crown already. I always ask my lab for a second die. So here's the, I've just dropped the magnification a little bit. Here's the die itself, and let's put this on. There we go. So you can see the fit and how nice it is, even with the zirconia method of scan and then made to the second die. It's amazing to see the fit. First die, second die, and then you have the solid model. And we usually send this red paper through there, and if it doesn't tear but it just pulls through beautifully, we know that our contacts are right. So and I've already showed you that on other videos. So here's his case ready to go in. He's got nice contact areas, nice anatomy built in on the labial as well as the lingual aspect. Very smooth surface, nice anatomy to the chewing surface. So we'll go right to the mouth. All right. Suction on, please. And air water syringe. I'm just going to take a pair of hemostats and just kind of wiggle this off a little bit. Hang in there. Let's see if it pops free here. Sometimes we have to section it a little bit. Oh, not quite cooperating. Let's see if we can use a spoon excavator. Let's see if we can just pop it off. There it comes. How about that? Now I use Duralon cement. I think Duralon is a nice cement. It's got some bacteriostatic properties to it. Here's the underside of the temporary itself. Looks great. Suction again. Yes, please. Now we're just going to use a Cavitron. This is a Cavitron with water. Let's see. I got my water. I know I paid my water bill. Okay. Give it another try. Nothing yet. Okay, we'll try a different spot. There we go. And we'll come around here. I need you to turn a little bit toward me. Great. Now last time when we pulled his temporary off, there was a lot of bleeding, and he had a subgingival margin on the distal, and we had to reline his temp, and we put everything back in place because it just didn't really wasn't conducive to getting an impression, yet alone a scan, for those of you with scanning out there. But as I blow air, you can see how nice and colorized the tissue is. It's looks great for subgingival margin. I don't see any bleeding upon air. So I'm blowing air now. I do have some remnants I have to clean. I'll do that very gently. You can close. Okay, I'm going to do it very gently with a small explorer, like this explorer. And we need a little bit of air in there, air on the tooth, and just go around 360. Perfect. All right, great. And keep retracting. And no suction, just retract only. We're good. Just retract. Yeah. That looks great. Here's a little cement. Duralon will sneak around somewhere. You got to be thorough when you're cleaning the cement. I could say I even cleaned the cement on this one, and still you find little remnants of cement. Nice and white. I like Duralon because it's white. You can see it. You've got to clean it. You can see it. I'm not sure if it's as good as cement for implants. I think they don't want Duralon on and around implants. Great. I think we're ready to try it in. That looks great. It looks like he did pretty well with his water picking. Okay, now we'll try in our crown. Okay. There it is. Now, Pierre's going to bleach his teeth, so we went a little lighter with that color of his crown because we're going to whiten his teeth. So you can see the lava crown is in place. I'm checking margins. The next thing I'm going to do is check the contacts in between the teeth. I'm going to do that with glide floss. Alright, close gently down together. You feel it hitting a little bit? Yeah, so he's hitting. Okay, no problem. Open. 8. Looking good. No rocking. It seats nicely. Margins look good. I'm going to dry and now we've got our floss just about ready to check everything. I'm going to look in between the embrasure spaces now. Excuse me. Alright, you okay? Everything good? Okay, embrasure space is good. Excellent. Alright. There's one contact. Now I'm going to have you hold with a blunt instrument. Just hold this down like that. Let me in first. Put it right in the center. Perfect. Just hold it. Perfect. Okay, let up a little bit. Hold it again. Stay put. Perfect. Okay, got good snap to the floss. Now it all comes from fit checking. It was a little tight on the model and I did relieve it, so good to fit check. Continue to do that out there. Now we're checking occlusion, so we got to mark it. Same thing with the suction. Close all the way down. Tap lightly on that. Open. So you can see there's a pretty flat contact right there, and then we have an opposing area. Close again here. So it's on the buccal side, so everything's on the buccal side. So what I like to use is a fine diamond. I get them from Microscope. They're called Neo burrs, and I like the fine diamonds. And I just set up a burr block like this. I have all my diamonds in a row, and you know, we put them through the autoclave, and also my fine diamond selection all the way here to the left. So again, you have to have a burr block that can give you everything you want, and then it gets autoclaved all together. It's nice. So everybody has their own preference and burr blocks. That was mine. Okay, so here is up in here somewhere. So let's have you close slowly. So you can see it's a little bit on that bicuspid on the upper. Open, please. So we're just going to relieve this just a hair. Alright, and I'll shut my water off now. Now I can get rid of the water. Okay, I'm going to dry off the teeth. And this bicuspid region here. Good. Close down together. Grind your teeth. Open. Just make the air angle in the long axis of the tooth. Yeah. Okie dokie. Tap tap again. In a downward position. Yeah. Is that a little better for you? You still feel it?
Yeah.
Still feel it. Okay. Getting better though. So just lightly adjust here. And here. Tap, tap, tap. Together. Good. Getting better. So it's real heavy contact on this bicuspid. Alright, close again. Tap, tap again. It's getting better though, right? Yeah. Okay, so still a high spot. Tap, tap, tap. Grind a little. Open. Okay, I'm going to need the Siltrax cord. Now, I got a question this morning. I tried to answer it before I got out here. I answered it last night, actually, a comment from a viewer about why do you use the Siltrax cord, or what kind is it, and why do you use it? So I wanted to answer that. I like Siltrax. I think it's very close to the 000, which is a very small braided cord from Ultradent. This one is Siltrax from Pascal Corporation. Tap again, tap, tap, grind your teeth. And it stays in from right after we try it in. I usually leave it in after I cement the case, and then we pull that out. It protects the soft tissue from any invasion of the cement. So we're going to, Pierre, put some suction in there now. I'm going to use a sublingual suction device, and we're getting ready to put your cord in. The cord looks like this. It's in the second drawer, and it's a sublingual. It's like a curly Q right over there, small one, thin. Yep, and that just pulls out. Yep, this is the cord. I'm going to dry this off. It's Siltrax is probably one of the nicest braided cords I've used. I've been using it for years. I've tried them all. I like this one because it's tuckability. If you look real close, you can actually see the braidedness of the cord. Very minimal amounts of fiber coming off of that. Does well when you soak it in Hemodent and then just rinse it and dry it thoroughly on the bib. We dry everything right here on the bib. Get it real dry. And then you want to get the sulcus dry. Now we're going to put Saliva Ejector in there. I'll show you how we do that. Cotton rolls too, and triangle. So I'm going to extend this little curly Q type of thing, and that goes under his tongue on that side. I'm going to place some cotton alongside of this tooth. And I might have to get up for a hygiene check in a little bit, so bear with me here. Alright, in a triangle. Okay, I think we'll take this one out, move this one back there. There we go. And Pierre, I'm going to have you hold this hose for me, alright? Just put that in your left hand. Yep, perfect. And you can relax your hand down if you like. Okay, we're good. Okay, so I'm drying. Downward position. Perfect. Even though, and many of you might think, well, gosh, doc, this looks good. I don't see any bleeding. Well, there's still crevicular fluid that's coming up. If you look at it, you dry it, and then it's wet again. You dry it, and it's wet again. So why are you going to cement on a wet surface and have more micro leakage in the long run? So put your cord in. Doesn't take very long. Just book enough time to do it. I'm going to use a little pressure. You can put that down. Alright, and we'll start off with just, are you okay? I always want to make sure they're okay. I'm just going to take another one of these without a sharp end on it. So grab one out of this middle drawer. Let's see, it's not, yeah, that's just the perio probe only, if you got one in there. If not, I'll take this. Okay, I'll take this one. I got it. Okay, I just need a little retraction right here. Okay, right here. Right there. Yep. My finger's going to go on this side. Okay, here we go. Great. Let's switch hands. I use two instruments many times. I'll hold and tuck, and keep going. He's not even anesthetized. I'm barely touching the tissue. You okay? Did I wake you up? I sometimes put a lot of people to sleep because of my so monotone voice at times. Okay. Looking good. See, just so you don't want to push too hard. You see the blanching? That's okay. A little bit of blanching going on here. Okay, so here I am. I'm up to 8 power, and wow, I'm having fun. Having lots of fun. What we'll do is, you can almost see these capillaries that have formed beautifully to heal the area and the site. Again, a little history about, we avoided having to have the tooth removed, and did a nice job with the endodontics and the core buildup without a post on this one because of the amount of tooth structure that's missing. Now I'm turning the corner on the lingual, the distal lingual, and I'm coming around to the lingual aspect. Now you can see there's a little bit of bleeding, so bleeding I'm probing still, so we still have to work at our home care. Alright. Not much of a sulcus on the mesiolingual as I turn the corner. Can sometimes use the blunt end of an Explorer, or I'll just actually just take the Explorer and round the end of it so it doesn't push too hard into the gingiva and cause any bleeding. So it works well. Look at that. Alright, now we can just take a pair of scissors. Look at it. And go in, and I'll just snip and hang on to. So I do this a lot. I just snip and go get it. And take it out. And you could take a suction in there if you want. I just snip and use them as a pair of hemostats. A scissor. Gotta have a good pair of scissors that you can pick up from Banco and just use them for a little while and throw them away. You don't have to buy the real expensive ones out there. Okay. Starting to like what I see and getting ready. But I gotta go check my time and my hygiene. Everybody has to do this, right? Gotta check your hygiene. So we'll scrub that with chlorhexidine gluconate. Someone asked me, why do I do that before I etch? Well, it cleans the surface of the tooth with a soap. Okay, suction. Alrighty. And we'll put that right in place. And you can see how that cord wanted to come out again. So it's tedious work, but you got to do it. I'm probably going to pack that area too with some pink cotton. I'll end up doing that. What I'm going to do now is use microsuction. Hold on. Put that on there. Alright. There you go. I'm going to go microsuction first. I want to get this detailed and in. Now instead of my other probe for packing, I'm going to use, this is a vacuum. So I want a drier environment because I want these guys to stay under the gum tissue. I want my cord to stay where I want it to stay. So I just follow now with the 20 gauge suction. It's more of an endodontic suction tip, but it works really well. It dries the sulcus, get everything in there beautifully. Perfect. Nice. I'll take it one more time just for this lingual, and then we're good to go. Alright. Now even, you know, with this, if there's still fluid, you gotta stop the fluid, so you gotta put some more, something in there that's gonna stop the fluid. We're gonna use something called pink cotton. It's from Gingipack. Again, we want to control the distal aspect. Everything else is perfect, so the distal is what we're working at. So we'll take a little pink cotton. Once I put the pink in there, I'm gonna stop the video recording, and then we'll come back for the cementing, which will be in about 5 minutes. You okay underneath? Yeah. So we're good to go here. Gingipack is from it's from Gingipack. It's a tuckable, very tuckable, pink colored retraction cotton. Now, not a cord, but a cotton. And you see how that flow on that distal, look at that, it's just getting out of hand. So here we are, we just introduced a little bit of cotton in that area and we induced some inflammation and some bleeding. And now it's just capillarying all the way around. So let me rinse this before I go in there. Now this is the pink cotton. All right, we're gonna dry this. I might need some more of this cotton. So let me give this back to you. We have some more? Okay, let me just take that whole piece and I'm gonna just pat it dry on the bib. This is Hemodent. I just use the bib, get it real bone dry, because then it'll be very tuckable. If you leave it in wet, you got problems. Okay, back we are. Just go ahead and drop it in there like so. Forget the rinsing, we'll do that later. Let's get this under control, shall we? So again, got my 20 gauge suction out. I'm tacking it in. He's feeling it a little bit, but it's only going to be for a short duration. Alright. We'll use our suction, go all the way around. It's kind of a waiting game. Retracting. Right here on the bicuspid region. Very good. Okay, this is Dr. Gerry Cuomo. I'm going to come back to you guys out there in a little bit just to show you the preliminary aspects of cementing my case. Now all this has got to be cleaned off. We'll do that right before we cement it. I will catch you on the next clip and we'll finish up. Thanks for watching.